And I went ahead and clicked the record button now. And all of the information from today's session will also be available on box.com following the session. I will make sure that everyone has access to that following today's session. And if you don't have access to it by next week, please do remind me and send an email along. Another thing I want to mention, as you can see here, we are all present with drinks and other things on the table here. I want to make sure everyone is comfortable. Feel free to eat during the session today. Feel free to drink. Feel free to be merry. Want to make this a comfortable experience for all of you while you listen to all of us today and join in yourselves. So we're going to start with introductions and announcements. That'll be about 10 minutes. We'll have a brief didactic presentation with discussion, questions, and answers to follow. And time permitting, we'll also be able to get to a case presentation with discussion to follow and some concluding statements and reminders.
Can I just chime in here for a second?
Yes, of course.
So I'm Tara Samt, I'm the director of the Survivorship Clinic, and I'm very excited to be here. This is sort of the agenda for almost all of the echoes, right? This is a general format. Today, because we have so many new people on the line and we're so excited to get to know you, the introductions may go a little long, and I think we just need to, I think the purpose of ECHO also is to be flexible. So this is kind of how it should look for most of the sessions, but today we really want to acknowledge that we might go over the 10-minute mark for introductions.
Absolutely.
And we want to be able to sort of have this be more conversational than anything. So this is our first one, and we're relying on you to give us feedback and help us shape the next ones.
Thank you so much, Tara. Appreciate it. And yes, so as a reminder as well, we try to keep things relatively fluid and mobile here. And so that way, when we're doing introductions and you introduce yourself, feel free to go by first name. We're going to go by a first name basis here. And want to make sure everyone is on board with that as well. Just wanted to bring up a few things, of course, before we get started here. I wanted to bring up a reminder about the case presentation form. I did send that out with the introductory email. I have that here as well, so you can see it. We highly recommend that you submit that back to us for case presentations in future sessions, starting for the next session. Can keep it relatively general. We try to make it relatively streamlined for you to fill out. We ask that you send it back 2 days prior to the next session if you choose to present a case or would like to present a case. But we do want to be fluid about it during discussion, of course. If you feel like, oh, I didn't have time to get to the case presentation form, but I wanted to bring up a case, please do bring that up in the discussion and we can discuss it at that point in time as well. And again, just to review, there'll be just some quick questions about the case you're presenting with why you chose the case, the challenges, what you wish you knew in primary concerns, some lifestyle questions, and past medical history and treatment. Okay?
And again, I think if you don't know the answers to all of these things, that's okay. This is just a skeleton to help think about why this case is interesting to you. That's what we care about the most.
Absolutely agree. All right. The next thing I wanted to bring up briefly was the memorandum of understanding that came out to everyone as well during or in the introductory email. We asked that any champions or point people for the site please return this to us. It's just an agreement saying that you're our participant and your site is participating in our Survivorship Echo, just with a signature, date, and role listed here at the bottom. Send that back to the Survivorship email listed here at the bottom, survivorship@yale.edu, or you can fax it back to the number here, which is also the same number that you joined in for the meeting today if you use the meeting ID. And thank you for that. All right, and I want to start with introductions and get to know everyone here. So we can start first with some of the people around the room. It looks like we have in our
should we go around the table first, and did we do people?
No. Yeah, we can do us first.
Us first? Okay, sure. So we will actually start with the hub team here. So again, I'm Jevin Britta. I'm the physician assistant here with the Survivorship program at Yale. I've been here since July of 2018, and you know, I'm obviously interested in survivorship working here. But of course, you know, I did my rotation as well at Dana-Farber for my oncology rotation. I had an experience with someone who was trying to get back to their normal after having completed 1 year of active treatment. And that inspired me to seek out this position and start here with my wonderful team, dare I say the best team. No offense to anyone on the channel. All right, we'll go right around the table.
I think what we're trying to do is just name an institution and why you chose to be here today, right? Okay.
Hi everyone, my name is Ashley. I'm one of the HEMONC fellows here at Yale. I'm excited for the ECHO. I've been working closely with the survivorship team and just excited to hear from everyone's experience and to learn along with you.
Hello everyone, my name is Reed. I'm a second year MPH student at the Yale School of Public Health in chronic disease epidemiology. Excited to be here. I just started with the survivorship team, so right now just soaking it all in, so thank you.
Hi, I'm Angela Karawa. I'm the clinical social worker on the Yale survivorship team. I've been with the team over 6 years now, and why I'm a big advocate for survivorship is this multidisciplinary team approach, which you'll hear more about, is just, it's amazing. You really are able to treat the whole patient. And as a patient just said to me today in clinic earlier, he felt like the multidisciplinary approach was a luxury because he got to hear from 4 professionals and get a different perspective on everything that he was going through.
Hi, I'm Scott Caposa. I'm the physical therapist on the team. I've been here since the clinic started in 2006. I do a couple different things with my role in the clinic, but really I'm excited to be a part of this team because we offer a bridge for our patients to move beyond their diagnosis. They're filled with questions and they don't know what the next steps are. And so with this approach, we can, like Angela was saying, we can approach that from many different angles and truly help for survivors move forward.
Hey everyone, I'm Maura, and hello to all my fellow dietitians out there. And I don't need to tell you how important the role of nutrition is in survivorship and how open people are to getting good information. So I look forward to working with all of you to address the unique nutrition issues of survivors.
And hello, I'm Tara Sampt. I'm the director of the Survivorship Clinic. I'm an oncologist and a hospice and palliative medicine board certified physician. I've been here since 2010. And I'm extra excited about this group because of how much enthusiasm there is. And I have a lot of, compassion and empathy for how we communicate with our survivors. And my interest is in trying to make a signature of care on the messages that survivors hear, because there's so much mismessaging out there. And so I'm excited to learn from you as well, the best ways that we can talk to our patients.
All right, thank you everyone for introducing yourselves briefly here. Again, this is Jevin with the survivorship team. I'm just going to share quickly with you
Wait, we want to get them?
the icebreaker for today. So I just wanted to let you guys know the icebreaker that we want to ask all of you while you introduce yourselves will be, what makes you interested in our survivorship echo? So with that said, I'm going to start unmuting people and let you introduce yourselves. First we have on the line A. Shad OF1. I'm going to unmute you. Go ahead. Just go ahead and introduce yourself. Say your role and where you're coming from.
Do you know who that is at all?
So let me see here.
Okay, we can come back.
So we can come back to you. It's ACHODOF1. We'll come back to you. All right, next we're going to unmute Courtney McGowan. Courtney, please introduce yourself, your role, where you're coming from.
Are we muted? Is the phone muted on the computer?
Courtney, go ahead.
Oh. Can you hear me now? Yes?
Yes.
Yeah? Okay. So I'm a registered dietitian in the outpatient oncology area at Yale New Haven Hospital. I've been here for about 12 years. I also am a interventionist on the LEAN study with Yale University. And in all of my time in both of these areas, I've become extremely interested in survivorship. I can see the value that it has with our patients, and I want to learn more from the experts. So.
Let's go back to.
Thank you, Courtney, for that. We're going to try the next person here. We can go back to.
We got Alina Chadoff is the guest at the very top. She says that I am a general internal medicine fellow at Johns Hopkins, and we are joining today to learn more as you embark on the journey of launching our own survivorship echo. So thank you so much for joining us.
Thank you, Elena, for joining us. Appreciate it. All right, next we have Emily Bosel. Okay, Emily, unmute you. All right, Emily, it looks like you're unmuted. Hi, Emily. It looks like for whatever reason we're not able to hear you.
She just texted into the chat box. She says, "Hello, all. I am a nutritionist at the University of Maryland Medical Center, Maryland Proton Treatment Center." Welcome, Emily. Thanks for joining us.
Hey, Emily.
Thank you, Emily. Hello. All right. So we're going to go down the line here. Next, we have Holly Almond. I'm going to go ahead and unmute you, Holly.
Hi. Can you hear me?
Yes, we can hear you.
Okay. Hey. All right. Sorry, I'll work on the video capability for next time, but I'm Holly Almond. I'm an oncology nurse practitioner in Corvallis, Oregon. We're a town of about 60,000. We serve about 250,000, and I wear two hats. One, I work seeing the medical oncology patients, but in 2013, I started with developing our survivorship program. So now it's 6 years later and still kind of working on getting that, but we've met our accreditations for COC and NAPBC, but it feels a little lonely. So it's nice to be a part of a bigger group, and I'm excited to get some experience from you guys and share mine with you as well.
Great.
Welcome,
Thank you so
Holly.
much, Holly. Welcome. Yes. All right. Next, just going down the line here, we have someone joined by iPhone. I'm going to.
Who's that going to be?
Yeah, I'm not sure who that is, but I will unmute you. Okay.
Hi, can you hear me?
Yes, we can.
Hi, my name is Amanda Bontempo. I'm calling from Manhattan, and I work at New York University. I'm a registered dietitian, so I found out about the Yale Echo through Maura, so thank you very much. And I worked with all modalities here at NYU Cancer Center as a registered dietitian. So transitioning to wellness and survivorship was kind of a natural evolution. So now I manage all of our wellness and survivorship programming here which is our one main location in Manhattan, a sister location in Manhattan. We have a satellite in Brooklyn, a satellite in Queens, and 2 on Long Island.
Big reach.
All right, that's wonderful. Welcome. Thank you. All right, and next we have Kendra Peterson. Go ahead, Kendra. Kendra, it looks like you're unmuted. Are we able to hear you? All right, Kendra, feel free to type into the chat who you are, where you're coming from in your role, and brief introduction as to why you're interested in our Survivorship Echo. Glad to read that or come back to you, okay? And next we have Christina and Victoria. I'm gonna go ahead and unmute them. Go ahead, Christina and Victoria.
Hi everyone, my name is Christina Kudemeyer and I'm an account rep here at the Echo Institute.
Hi, I'm Victoria Chavez, also an account rep here at the Institute.
And we're just here to observe today.
Be helpful if I unmuted myself. Thank you, Christina and Victoria, for joining today, and a special thank you for making yourselves available to us today as well. All right, and next we have Courtney Malcher. I'm gonna go ahead and unmute you. Courtney, go ahead and introduce yourself and your role.
Hi, can you hear me?
Yes.
Oh, hi, I'm Courtney Malcher. I'm one of the dietitians at Smilo Cancer Hospital, and I am just interested in learning a little bit more about the survivorship. I like the program as it does bridge that gap as from treatment to kind of the next steps, and I'm just excited to learn about how to help patients with that. So thank you.
Thanks, Courtney, for joining us today. Appreciate it, and we'll see you over there. And next we have Marielle Ugayon. Please forgive me if I'm mispronouncing that.
Can everyone hear me?
Yes, yes.
Okay, awesome. So my name is Marielle, I go by Mari for short. I am the program coordinator for the newly formed Hopkins Survivorship Echo team. So I'm just here to observe the session and learn from you all.
Great. Welcome. Thank you so much, Mark. Appreciate it. Next, we have Mary Hodges. Mary, go ahead and introduce yourself.
Hi, I'm here. I'm the dietitian at oncology at Parkland Hospital in Dallas, and I actually have my social worker and one of our oncologists and mid-level providers and everyone here. So we are very excited to hear about survivorship and how we can implement that here. We are a county hospital, so we have limited resources. So for us, this is very important, and this is, you know, we'd love to hear what works so that we can kind of figure out what works for us.
Great.
I just want to say it was really Mary's post on the CSO listserv that started this whole group here.
Wow.
Thank you, Mary.
Thank you.
Did you realize that?
I didn't realize that, but I just wanted to know what works so we can do that. Make everything a little bit better.
Mary, it sounds like you're breaking up a little bit on our end. Forgive us for interrupting. Just wanted to let you know. So we couldn't hear that last bit, but thank you again for joining us and helping to get this started. Really appreciate that. All right.
I have one person to introduce, Kendra Peterson. She is one of the 2 nutritionists at the Ironwood Cancer and Research Center in Phoenix, Arizona. They have 9 outpatient offices, and she covers 5 of those 9. And they are in the beginning stages of creating a survivorship program. So thank you, Kendra, for joining us. Welcome.
Thank you, Kendra, for joining. All right. And next we had Pam Perkins. Pam, I'm going to unmute you now. Go ahead. Pam?
Dietitian at the Maine Medical Center Cancer Institute. And I've been an inpatient dietitian working on all kinds of units and things and with the nutrition support team. And I just transitioned to the outpatient cancer world about a year or so ago. And I'm new to the survivorship clinic that I cover. I'm really enjoying it, and I'm just looking for more information to help the patients. And Maura, thank you for sending out that email to get us all connected.
You're welcome.
And thank you, Pam, for joining us today, and welcome again. Yes. All right. Next, we had, again, another guest here. The name is listed as RP.
Well, we know Renee. Renee came and shadowed us.
Oh, Renee.
She's from
New
New
Hampshire.
Yeah.
All right. Hi, Renee. Yes.
Hi.
Sorry about that. I wasn't looking up at the screen.
Great. So I had the opportunity to visit Yale last month and meet everybody. I'm a nurse practitioner in Concord, New Hampshire. I do internal medicine and started our survivorship program about a year ago. So here to kind of join up and see how things are. Am I back? Strange. Hello?
Renee? Hi, sorry about
Technical.
that.
It's okay.
It sounds like
I think the video is going and the phone is going.
yes.
Right? So we're going to mute ourselves, and could you introduce yourself one more time? We'll see if this works a little better.
Yeah. Let me. I see what you're saying. Can you hear me okay? It's double speaked.
All right.
Well, you guys know me. You can introduce me.
Go ahead.
We're all set. Go ahead.
Can you hear me?
Yes, much better.
Okay.
Sorry about that.
Oh my gosh. All right. So I'm a nurse practitioner up here in Concord, New Hampshire. I do internal medicine and 1 day a week in our survivorship clinic. I'm really the only provider here, so we're trying to see what's best for the clinic and how we can expand our current roles here. Am I still there? Okay,
yes.
great.
Thank you, Renee. Appreciate it. Thanks for joining today. Next, we had Strykemj, Strykemj. Go ahead and introduce yourself. All right, we had unmuted you. Again, Strykemj. If you're still there. All right, we'll come back to you. Feel free to use the chat on the right to send in your information about who you are, where you're from, and your role. Next, we had Yukon Health, and I believe this is Sarah Lashovska. Is it Lashovska? I'm mispronouncing it, forgive me, but I'll let you go ahead and introduce yourself. You're unmuted. Thank you.
Hi, good morning. Can you hear us?
Yep.
Yes. Thanks, Sarah.
Hi, this is Sarah Lashavo, the Program Director for Oncology Supportive Care and Survivorship at UConn in Farmington, Connecticut. I'm joined by 2 registered dietitians, 4 navigators, our social worker, and Ellen Shaw, our Associate Clinical Director. And so we're looking to expand and enhance our survivorship program here at UConn.
Fantastic. Thank you, everyone, for joining us today here. Appreciate that.
Thanks for having us.
Of course. All right. And then we have a 207-396-7760. I'm going to go ahead and unmute you now. Hello?
Hi, this is Barb Perry. I am the Survivorship Program Manager for the Maine Health Cancer Care Network. And I don't have the audio. I'm just doing, I don't have the video. I'm just doing audio today. And I am the only person in the survivorship program for this large health system. We have 11 different hospitals around the state, and I'm trying to coordinate comprehensive survivorship care and planning, and trying to work with staff to get them on board with analyzing workflows and doing survivorship care plans, and trying to take a look at what are the resources and what are our gaps, and how do I kind of improve the quality of life for the survivors that we have in the state. So I'm really excited to be a part of the group, and hoping to learn lots and contribute perhaps a little bit myself. So thank you.
That would be wonderful. Thank you.
Well, you know, Barbara, that's one of the themes of survivorship that we often extend is, you know, you're not alone. We're all in this together. So
thank you.
You're welcome. Okay. And then last guest we had here at the bottom was 41266 number. Gotta go ahead and unmute you.
Yeah, excuse me, can you hear me?
Yes.
Yes, I can.
Yes.
Okay, great. Sorry about that. My name is Rachel Harkin. I am a clinical dietitian at the Allegheny Health Network in Pittsburgh, Pennsylvania. And I'm sorry I couldn't join via video today either, but so I'm also part of a very large health system. I was the only dietitian, have been able to get 4 more dietitians to some of our other locations. But I'm under the navigation program, and they have a new nurse navigator solely for survivorship. And I was hoping she could join this group, and I'm still going to push her to join. But I wanted to learn a lot more too about survivorship, and hopefully work with the navigation team so that we can do a better job at our institute in this area. So I'm really happy to be part of this group, and looking forward to learning a lot.
Great. Thank you so much for joining today, Barbara. I appreciate that. And yes, she would be welcome to join as well. Feel free to pass along the information you've been given already, or reach out for that information to be passed along to her.
And then I just want to say welcome to Vanessa Solino, one of our other dietitians who is joining Courtney as well. Thanks for joining us.
Hey, Vanessa.
Vanessa. All right. Well, thank you everyone for introducing yourselves and joining us today again. So next on the agenda, we'll be going to the presentation that we have on survivorship. Give me one moment while I pull that up for everyone to see.
Before Jevin gets started, I just want to encourage everyone to use the chat box and to write in questions whenever you think of them, so that we can continue to address questions and make this as discussional and interactive as possible. I'm going to be monitoring, so please shoot questions as they come to you. Great.
Yes. All right. Thank you, everyone. Let's just jump right in here, okay? We're going to be starting with the basics on survivorship. We're titling it Survivorship 101. As you can see, this is our team here as on camera today. All right, sorry about that. Okay. There we go. Here's everyone here today with us. The wonderful woman in the middle, Kiki, she's our program coordinator. She is not with us today, but will be joining us for future sessions as well. So for today's financial disclosures, there are none for this presentation. We do have some objectives for today's session, and those include learning about the definition of cancer survivorship and who cancer survivors are, some statistics about survivorship, the phases of survivorship that we consider, some concerns that face cancer survivors and are unique to cancer survivors, and the multidisciplinary approach to cancer survivorship. So first, who is a cancer survivor? Cancer survivors are anyone who have been diagnosed with cancer from the time of their diagnosis throughout the rest of their life. And in survivorship care, we really try to focus on treating the whole person, thinking about late and long-term effects, whether it's physical symptoms, psychosocial concerns, such as mental health and well-being, fear of recurrence, things like sexual health, spiritual concerns, and then health promotion as well, with things like nutrition and exercise and physical activity. We also think about surveillance and counseling on that, and follow-up recommendations as well. Just wanted to highlight here some of the statistics about the growth of survivorship over the years, in particular looking at cancer survivors themselves from 1975 projected out to 2040. And as you can see, there's projected to be, and it has been, a large growth in the number of survivors, about 18 million or so now, projecting to be up to over 26 million in 2040. And this growth is really twofold. You see up front that there are better treatments and better outcomes, yielding more cancer survivors. And then on the back end, you have survivors who have been multiple years out from their diagnosis, now living longer, thanks to better health care and health maintenance. And we also have an increasing age in our population, which is also contributing to the number of cancer survivors. So you might be asking yourselves, where did this start? Well, we can sort of date back to about 2005, when the publication Loss in Transition was released for the Institute of Medicine. And what this highlighted was the need for survivorship care, as you can see from the previous slide on the growth of cancer survivors and the boom in cancer survivor numbers. It highlighted that there really aren't any standards or best practice guidelines. There's insufficient communication between oncology and primary care providers and other providers. There needs to be a greater focus on surveillance for survivors and long-term survivors. And really this was meant to help foster development of those guidelines, a need for research, and utilization of a survivorship care plan for cancer survivors, which outlines their diagnosis, their treatment, and follow-up recommendations.
I think what they found was that there was mostly a focus on surveillance and that a lot of the other needs were not necessarily met. So most survivorship programs just focused on, is the cancer back, yes or no? And if the answer is no, then just go along. And so we know that that's insufficient.
Right. Yeah. And then next I wanted to highlight, again, how we think about cancer survivorship with the phases of survivorship here. So first, we think of the time period at the time of diagnosis through active treatment, sort of as the rough rapids, the acute phase of survivorship, when patients at that time are having all they can do to deal with the gravity of their diagnosis, the treatment they receive. Will this treatment work to help cure their cancer? How are they going to afford all the treatment and management of the side effects? Can they handle the management of side effects? And how is their life going to change at home, in the workplace, and so on? And what are the physical limitations they might have as a result of it? And oftentimes in this phase, long-term follow-up can be explained, but unfortunately can be missed, not because it's not explained to them, but rather because all they can do is just focus on their diagnosis and the treatment they're receiving. So next, we think about the extended phase of survivorship, where they're now having completed their active treatment and moving on to life after treatment. And what does that look like? Is it going back to their normal or developing a new normal? And there are a number of concerns that survivors face at this period of time, with things like fear of recurrence, management of the side effects from treatment, the late effects from treatment. Again, going back to those lifestyle changes and how they might now be limited in some ways. Oftentimes they might be dealing with mental health concerns to go along with the fear of recurrence, like anxiety, depression. Concerns over their own body image. Maybe they've had a mastectomy for breast cancer or a soft tissue sarcoma removed, and they view themselves differently. It can also affect sexual health in that way. Another thing on the flip side of that is maybe they've tolerated treatment really well, and as they're getting back into their life from before diagnosis, they're realizing, people are treating me the same. There really hasn't been much concern about my needs now. But they still have a number of unmet concerns. And so these are a lot of the topics we think about in the extended phase of survivorship in those first 5 years or so following diagnosis. And then lastly, the long-term phase of survivorship, where this is beyond the 5-year mark after 5 years of diagnosis. And they're transitioning now from the extended phase to the long-term phase, where they're thinking about the achievement of cure as it goes. And perhaps they've been discharged from their oncology team and they're going back to just follow up with primary care. What does that follow up look like, and how might that differ? They could still be dealing with some of the long-term effects from treatment still and some of the work-related issues and issues with relationships and family. And so those are, those are the 3 phases of survivorship that we consider. Next, I wanted to highlight some of the tenets of survivorship care. Again, mentioning surveillance here, we think about counseling on the appropriate follow-up recommendations with appointments and imaging and labs, the identification and treatment of latent long-term effects, such as helping survivors to identify effects that may not even realize they have, and counseling on treatment recommendations and referrals. Overall health promotion with exercise and nutrition in mind, and overall well-being. And then coordination of care, helping to point survivors in the right direction, where they might not otherwise know who they need to be referred to or see next. As I mentioned before, survivorship care plans are part of the survivorship clinic, where they are given a survivorship care plan outlining their diagnosis, treatment, and follow-up recommendations. But is handing survivors this enough? And the short of it is no, it's not. 96% of survivors suggested that a face-to-face explanation of this by an oncology provider is more helpful. And there are a number of unmet concerns that might come up through questions or explanation of this. Things like fear of recurrence is a prevalent concern, changes in quality of life and coordination of care. And unfortunately, a number of these concerns are unmet. Next, I wanted to highlight some of these concerns with the scope of issues here. First, with chemotherapy, you might see some concerns like cardiac dysfunction, cognitive issues, and so on. Surgery with post-surgical pain and cosmetic defects. Radiation with lymphedema and maybe some radiation fibrosis or scarring buildup. And then there's a number of common concerns amongst the 3, things like fatigue or pain, fear of recurrence, and other mental health changes. Concerns about weight, supplements, nutrition, patients being debilitated or feeling they're deconditioned now, sleep issues, and so on. And next, I just wanted to highlight the scope of issues here again, even amongst some of these subsets of categories. I'm not going to go through this in detail, but as you can see, there are a number of potential concerns, and even more than this, that fall under this umbrella and the sub-umbrella, so to speak. I did want to highlight. Absolutely. I want to highlight some of the late effects and lifestyle considerations here. Wink, wink, Easter egg. This could be coming in the near future in future sessions. Fear of recurrence is the most common need by cancer survivors. Fatigue is another highly experienced effect that cancer survivors face. 80% of those who've received chemotherapy and radiation can last up to a year following treatment. Lifestyle considerations with exercise and weight management. As you can see, there are a number of considerations there. And it can be beneficial to address this for overall health and fitness, symptom management, and reducing risk and recurrence and mortality. Sexual dysfunction is another concern that can affect both men and women. Again, this can affect people beyond just pelvic malignancies as well. And despite this, less than half of people with these concerns have received medical care for it. And there are a number of barriers for sexual dysfunction as well. Secondary malignancies, though uncommon, are certainly possible dependent upon the treatment received. And about 8.1% of cancer survivors face this struggle as well and concern over this. And then peripheral neuropathy, of course, can be a common symptom experienced by some who have received chemotherapy. It can be a common symptom seen in up to 40% of cancer survivors, starting in the acute phase of it with treatment, active treatment, extending out to the late and long-term phase. And lastly, I wanted to highlight lymphedema as well. This can occur in up to 20% of cancer survivors based on the Livestrong survey from 2010 and can be a result of surgery and radiation treatment.
I think the idea here is just to highlight that there are some unifying issues amongst survivors, and it could be of all diagnoses. So those of you who are running survivorship clinic You see probably lots of different people, and these are very common things that you probably see. Look forward to hearing from you about your experiences with these patients.
Absolutely. And again, highlighting some of those concerns, you can see that it lends itself well to a multidisciplinary approach. They might need to speak with someone in physical therapy or a registered dietitian or a social worker, or so on. And what's great about this approach is that you have an expert team who can address these long-term and late effects, and multiple services are provided in one location. So it's sort of like one-stop shopping, and it's convenient for survivors. And it's a great model, again, for complex patients as well, who might have other comorbidities or significant past medical history. Without further ado, I did want to allow our team here to introduce themselves. Again, we're a multidisciplinary team here. We see each survivor for 30 minutes at a time with an initial visit and offer an 8-week follow-up. And at that visit, survivors receive an individualized care plan. So Tara, I'll let you lead things off.
Okay. So again, Jevin and I both see patients, and we are the medical piece of all of this. What we do in our visit is to give the survivorship care plan. A lot of our session focuses on the treatment summary and that surveillance plan going forward. We also make sure that patients have their care coordinated. So we talk about other cancer screenings, health promotion, in terms of safe sun activities and making sure they're up to date with their vaccinations. What I wanted to say today, what I think is so important about the medical piece of a survivorship visit is really the communication and making sure it's patient-centered. And I hope you hear that from all of us, but we try to meet the patient where they are. And so what's different from a normal oncology follow-up visit is that we spend a lot of time asking patients about their concerns and just addressing those concerns. And sometimes that's the most therapeutic thing that you can do. So I'll stop there and then we'll pass it on to the next person.
Excuse me, jumped a little bit ahead here. Okay.
Okay, hi, it's Maura, the dietitian. So I just wanted to highlight a couple of the big nutrition concerns that are commonly present in clinic. Big one is weight management. Now you have to understand this runs the gamut of either major weight loss or weight gain. So both ends of the spectrum. You could have a head and neck patient with a significant weight loss from treatment, and you can have a breast cancer patient who has significant weight gain from treatment. So it runs the whole gamut. A lot of my job is spent reframing weight goals with patients. And I find it more useful to look at weight change over time. So I always ask, what was your weight pre-diagnosis? What was your weight at the end of treatment? What is your weight now? And that picture, that trajectory gives me a terrific story of their journey in terms of weight and then nutritional status. So I find that really helpful, much more helpful than using any BMI parameters. So I wanted to emphasize that. Next, this is a word cloud I created, and these are all concerns brought to me from cancer survivors at clinic. And you can see it's everything. And oftentimes it comes to me as mixed up as this. Person comes in saying, there's so much information out there and they don't seem to agree. So really, I think there's a lot of confusion out there, and we really don't know what it means to eat well. A lot of people come in feeling that way. And if anyone read that New York Times article over the weekend about how promoting red meat, you know that what we're up against. It's like, it doesn't help. So, so a lot of time is spent sorting through this information and sifting through this information and having the patient leave feeling like, oh yes, we do indeed know what it means to eat well. And my job is to help them find that for themselves, with their own preferences. And lastly, I'll end with, again, we'll do deep dives into these topics in subsequent sessions, but supplements are a big issue with survivors. Oftentimes the question is to me, what supplements should I take to prevent cancer? And what foods should I not eat to prevent cancer? It's kind of the opposite. And what I say to them is, no, it should be, what foods should you be eating to protect yourself and less reliance on supplements. Because there is the myth out there that more is better. And some people come in with very strong health beliefs about the supplements that they've determined to take either by their own search on Dr. Google or from well-meaning family and friends. So oftentimes my job is just to make sure there's no harm being done. There's no interactions with their current medications, and they're not exceeding any tolerated upper limits of supplements. So again, we'll do deep dives into this in subsequent sessions. Feel free to, in the chat room, send any questions that you have right now. I'll pass it on.
Thank you, Maura.
So as the physical therapist on the team, there's a lot of different things that I can screen for as far as fatigue and range of motion, peripheral neuropathy. Really, the list goes on and on. But really, one of the big things that I see, so there you go. And really can run the gamut as far as range of motion, depending on what kind of surgery they had or if they had radiation, decrease in strength. A lot of times with chemotherapy, we see a decrease in balance. If they have peripheral neuropathy, that's going to affect their balance. Managing their decreased energy and their scar tissue management, we will make sure that if somebody needs a lymphedema follow-up, that we will refer to right specialists for that. There is a new thing now within our profession that there are board-certified physical therapists in the country. So if you're looking to recruit a physical therapist as part of your team, you can search for one of those. That they do have the new board certification in oncology physical therapy. Kevin, if you can go back just 1 second.
Yes.
Just really quickly, one of the big things that I see when I'm trying to instill on our patients the American College of Sports Medicine recommendations for exercises. How do I exercise? So many people come in and they say, I don't know how to exercise. I'm afraid to exercise. You may also get the person who exercised beforehand and they have to deal with, I was doing all the right things. I was eating well, I was exercising, and I still got cancer. So what am I supposed to do now? And again, as Tara was saying, we meet the patient where they currently are when they're sitting right in front of us and come up with a really detailed plan to help them move forward.
All right, thank you, Scott. And next, we're going to have Angela share a little bit. Angela, go ahead.
Yeah, so I'm Angela, the clinical social worker on the team, and when I meet with patients, my goal is to provide them with an opportunity to talk about how they're doing emotionally. Cancer survivors aren't only dealing with the fact that they had cancer, but also the impact that cancer has had and may even still be having on their lives. And it's really important to note that cancer survivorship doesn't just impact the patient emotionally, but it impacts all aspects of their life. Socially, emotionally, spiritually, financially, sexually, which is why that little graph is up there. And there's a lot of interconnectedness between and a lot of overlaps. It's not uncommon for a patient to come into our clinic and they might be experiencing fear of cancer recurrence. And because of that level of anxiety and worry, it's impacting their sleep, which then makes them tired. So then they don't feel like exercising. And then they're making unhealthy food choices or strange food choices because of that fear of recurrence. When I'm meeting with patients, again, all of us have echoed this, but really starting where the patient is at, being an active listener, being fully present in listening to their story, normalizing their feelings, but most importantly, emphasizing that they are not alone and that other cancer survivors think and feel the exact same way that we do. It's pretty common. Just some common themes that, and I guess a little taste for what's coming, but fear of cancer recurrence is pretty common. Concerns about depression, anxiety, even some post-traumatic stress disorder, cancer-related fatigue, issues with sex, finances, and purpose and meaning. Actually, that comes up quite a bit, finding purpose and meaning after cancer. Thank you.
Thank you, Angela, and thank you, everyone, for talking a little bit about what each of us do. And again, I just want to second what Tara said. I'm in a similar role as to what we do on the medical oncology side of things, and I help to develop the survivorship care plans up front as well that patients receive at the visit. And so thanks for listening to that for a little bit. I'm just going to jump back into the presentation. here.
So yeah, we have about 5 minutes left.
And we
I
just
think
had,
we should just maybe do the summary and then move forward with the
sure.
kind of a discussion and see what's going on in the chat room.
Sure. All right. Today we talked about cancer survivors, including anyone who's been diagnosed with cancer, with survivorship focusing on health and life of a person with cancer throughout the remaining period of their life. The number of cancer survivors continues to rise and highlights the need for survivorship care nationally. Cancer survivors have several unmet concerns that might include psychosocial issues, physical symptoms, and long-term effects. The multidisciplinary approach to survivorship care helps to address these needs, and it's important to capitalize on the teachable moment, which I know we didn't get to too significantly, but again, survivors are very malleable at the time they come to see us, so it's important to work with them and their ability to reach an overall healthy lifestyle at that point in time, which they're oftentimes seeking. With that said, thank you everyone for listening to our presentation today. Leave you with this shot of our Smilo Cancer Center Healing Garden. Hope it brings you some peace today as well. And we will field anybody who has questions today as well. All right, and so for the questions, I want to invite you again to use the chat feature available on the right side. Press enter to go ahead and send along the question. If you're on the phone, you can also raise your hand, relatively speaking, through audio, through pressing *9, and unmute yourself with *6, but we can also unmute you on our end. So I'll open the floor to anybody who has questions.
Don't be shy.
All right, so I'm not sure that we're getting anything quite yet, but we will keep watching in the chat as well. I'll address the team here quickly. Does anybody have any other thoughts on our survivorship clinic?
Well, I just want to say for the audience there, we'll give you a follow-up email, and there's going to be a post test, but also a free form area where you can list their topics that you're particularly interested in. We mapped out a curriculum, but we really want to be responsive to your needs. So you can be very specific as to issues you're interested in, and we will adapt and address those. So, please give us that feedback. I mean, we mapped it out what we thought you needed to hear, but you know what you need to hear. So,
do we want to go through kind of what we thought the next few sessions would look like and invite some feedback for that today?
Sure.
What do we have on board?
So coming up for the next few sessions, our next session will be talking about nuts and bolts of survivorship, talking about how referrals work, are patients eligible to come, and when are they eligible to come, what meets that criteria for eligibility, insurance and pay-related concerns they might have, and so on. So highlighting some of the logistics about setting up a survivorship program as well.
And also what pre and post tools we use at a survivorship visit,
yes,
which are really helpful.
Yep, absolutely. And then next we'll be talking about fatigue. That will be our next topic of choice, as you saw earlier today in the presentation. It's a concern that many survivors have. So we thought, what a better one to choose to lead off the group of sessions on some of these late effects and lifestyle concerns than with fatigue. To dovetail that, we also have a session on overall energy and weight management with concerns about nutrition and exercise. So we'll be addressing that as well. We're going to have a session on some late effects that survivors may experience, which will highlight some of the concerns we talked about today. We'll have a session on fear of recurrence, which will highlight some of the concerns from the mental well-being standpoint that survivors have with fear of their own cancer recurrence, fear of other malignancies, and how to best address that and how it might feed into or be fed from other mental health concerns. And then our last session will be highlighting some other specialized topics in survivorship as well. We can always, make this to be determined and see where everyone's at before doing this, but some of those topics might include some special populations, some of the care plan generation, and so on. We'll get there with that and see if anyone would like to talk about anything else. I do see we're getting a number of responses in the chat.
I'm just
Oh, okay. Sorry, forgive me. Nothing right now.
But the idea, I think, and the ECHO group is on the phone observing, I think ECHOs in general are meant to be flexible and driven by all of us who are participating. So please think about this. Why did you sign up for this? What are you hoping to learn? We want to be the hub of this, but all of you folks are so important to the participation and the success of this project that we can throw out everything we've planned so far and rearrange things based on your feedback. So this is going to be sort of a really exciting thing for us, and we're going to be nimble on our feet. And I think the idea is to share our perspectives and bring about cases that how do each of us approach these types of people, and you're seeing the same person but you're coming at it from so many different angles, so we want to hear from all of you what you're hoping to learn about as well.
Absolutely.
Ashley, is it still you typing?
Yeah.
Okay. So we're pretty much at time.
Yeah, we have about 2 minutes left. I'll give you guys another moment to type in or volunteer if you have any questions. I just had some final thoughts. I just want to remind you of our next session. That will be coming up on October 16th in 2 weeks. I will send along an email following up this session and a reminder about a week out from that session as well. I do want to remind everyone one more time about the case presentations. If you'd like to present a case for those sessions, feel free to reach out about that. I did provide everyone with the case presentation form, and we'll send that along in future emails as well. We ask that you submit that again 2 days in advance if possible. But again, encourage all of you to bring up if you want to talk about a case maybe without having the time to actually go through the case presentation form. Let us know in the discussion during one of these sessions, and we'd be happy to talk about it. Additionally, I do want to offer my help or our help with the case presentation form, and if you'd like to run a mock presentation with me or one of us, we'd be happy to do that with you as well. Just try to allow for some ample time beyond the 2-day advance point to give us to set up a meeting so we can go through that presentation with you. We also just want to remind you again, for those of you who haven't sent back the memorandum of understanding, just so we know who's participating, please send that back to the survivorship@yale.edu email address or fax it back to 203-737-8357. You can just have the survivorship champion or the point person for your site sign that, date it, and write in their role and send that back to us. And we thank you for your doing that in advance.
So 2 brief logistical questions. Somebody asked about some help with video. We're happy to work with you kind of outside of the session to try to help triage how to get your video working prior to the next session. So reach out and we'll figure out a good time to work with you. And we'll be sending out the case presentations, a summary, and updates and reminders before the next session. So you'll be getting the case forms and everything needed for the upcoming sessions in emails to be delivered to your inboxes.
Yes. Thanks, Ashley. And maybe if we can even type in our email address and fax right into there.
Okay. Thank you, everybody.
Yes.
This was a great first session, and we look forward to seeing you again in 2 weeks, right?
Yes, 2 weeks. All right, October 16th, same time. It'll be 2 to 3 p.m. Eastern Standard Time. Bear that in mind that there is a time difference between the time zones as well. All right. Thank you, everyone. Appreciate all of your interest in joining us today. Take care.
echo or?